Valerian is known for its anti-anxiety and its calming effects, and for promoting restful sleep. It's native to Europe and Northern Asia, and it's been used for millennia as a sleep aid. It promotes feelings of calm, decreased levels of anxiety and stress, and it enhances sleep. It's traditionally been used for the treatment of headaches, anxiety, heart palpitations, high blood pressure, irritable bowel, menstrual cramps, epilepsy, and childhood behavior problems. As a nootropic, valerian is used primarily to lower stress and to promote a good night's sleep. Valerian helps to boost GABA in the brain. It inhibits GABA reuptake, and it modulates serotonin and norepinephrine, and it activates adenosine receptors. Valerian acts like an anti-inflammatory by reducing NF-kappa B and improving blood flow by acting as a smooth muscle dilator. Valerian helps to eliminate stress by boosting GABA, serotonin, activating adenosine receptors, and reducing the stress hormone cortisol. The sedative effects of valerian were first mentioned by Hippocrates several thousand years ago, and it's since been confirmed in clinical trials by modern medicine. Valerian likely got its name from the Latin word valere, meaning to be healthy or strong. The Greek physician Galen used valerian for treating epilepsy and insomnia. Its modern use likely got its start in 1567 by the Italian nobleman Fabio Colonna, who suffered from epilepsy. He found Galen's reference and claimed it completely restored his health. Valeriana officinalis contains around 150 compounds, but the ones identified of clinical importance are valproates and their breakdown products. Valerian also contains the amino acid arginine, GABA, tyrosine, and glutamine. Valerian is the most commonly used herb to induce sleep in the United States and in Europe. Research continues to establish accurately why this supplement works to help people sleep. So far, science has determined that the compounds valerianic acid and bornyl acetate found in the valerian account for its sleep-inducing quality. These compounds inhibit the breakdown of GABA in the brain, resulting in sedation, and the aqueous extracts, the water-based extracts of the valerian root, contain significant amounts of GABA, which could directly cause sedation. Researchers at the University of California in San Francisco did a systematic review of all the sleep-using valerian studies that they could find, to find out if valerian really did improve sleep like everyone said. The team found 16 randomized controlled trials, totaling 1,093 patients that satisfied their criteria. Doses ranged from 225 to 1,215 milligrams of valerian per day. Only 2 studies stated that the herb was standardized to a specific amount of valerianic acid. The evidence overall was clear. Valerian is a more attractive option to other sleep agents because of the lack of a hangover effect the next day. And overall, patients got to sleep faster and had a better quality of sleep. A natural alternative to benzodiazepines, valerian helps to reduce anxiety, and it helps you cope with stress. GABA is the primary inhibitory neurotransmitter known to counterbalance the excitatory neurotransmitter glutamate. And research shows that often those suffering from anxiety disorders are dealing with a dysfunctional GABA system. Of all the studies demonstrating valerian's ability to help control anxiety and stress, it's best shown in the following study. One of the most stressful and painful procedures in female medicine is hysteron salpinography. This procedure evaluates the uterine cavity and the fallopian tubes, and is typically performed on infertile women. In this study, 64 infertile women who were undergoing this procedure were given a single dose of 1,500 milligrams of valeric capsules 90 minutes before starting a procedure. The valeric acid is one of the active compounds that's found in valerian. Anxiety severity was measured before and then again 90 minutes after the procedure. The researchers concluded that the valerianic acid in the valerian significantly reduces the anxiety in the women who are undergoing this HSG procedure. Chronic stress, anxiety, poor blood flow and free radicals, known as oxidation, can damage your brain, and one of the ways that it manifests is through memory loss. It comes as no surprise that people with memory loss experience higher rates of anxiety and depression, as was verified in one Australian research study. Chronic stress reduces memory capacity. Toxins kill brain cells from the inside. Free radicals destroy neurons and synapses. Neurotransmitter levels decline. Brain-derived nootropic factor also declines. Under conditions of chronic anxiety, your brain loses the capacity to transmit signals between neurons efficiently. Memory, cognition, and decision-making all suffer as a result. The valerianic acid and valerenol in the valerian bind to the GABA receptors, and this provides its anxiolytic effect, like the prescription drug Xanax and Valium, but without the side effects that are associated with these pharmaceutical drugs. Studies show that the valerianic acid also modulates serotonin and norepinephrine in the hippocampus and the amygdala regions of the brain, also providing an anti-anxiety effect. Valerian helps to reduce the time that it takes to fall asleep, and it also provides a better night's sleep. One Swedish study showed that valerian provides perfect sleep for 49% of the people in the study, and 89% reported improved sleep when using the valerian. Valerian seems to cause sedation by increasing the GABA levels in your brain. The valerian provides GABA as one of its natural compounds, prevents reuptake of GABA in the neurons, and it inhibits the enzyme that naturally degrades GABA in your brain. Valerian helps to ease menstrual cramps in women, which naturally provide an anti-anxiety effect also. Valerian helps to reduce hyperactivity in those who are dealing with ADHD. Valerian reduces symptom severity in those with restless leg syndrome, and it improves sleep quality. The extract has been used for years in Iran to treat epilepsy. One study in rats showed that the valerian extract provides this anticonvulsant effect by acting on the adenosine receptors. However, a petroleum ether-based extract of valerian did not provide the benefit in epilepsy. Valerian also helps to reduce the symptoms of obsessive-compulsive disorder. The effects of supplementing with valerian can help to tame anxiety and help you sleep. Valerian for sleep doesn't act like prescription sleeping aids, which make you feel that you can't stay awake. Instead, valerian before bed helps your body and your brain to relax and allows you to drift off to sleep naturally. Some people report experiencing vivid dreams when using valerian before bed. Users report that valerian extract is better than Valium or Xanax for combating stress without the side effects. If you're dealing with ADHD, you might find that adding valerian to your diet will also help to calm you down and turn off your mind enough so that you can get some rest. Users report that valerian also helps to tame the symptoms of restless leg syndrome. A few say it even helps to calm the symptoms of Parkinson's disease. Some say using valerian helps to eliminate migraines. Low-dose valerian may help to alleviate social anxiety for some people also. The valerian has been used to treat insomnia since ancient times. In an open-label case series of 11,168 patients, over 70% reported that valerian was effective in helping them fall asleep, reduce sleep disturbances, and it decreased restlessness and tension. A study conducted in Germany with a stack containing valerian and hops reduced sleep disturbances caused by noise in a high-traffic area. This combination also increased slow wave and REM sleep. Hyperactivity, impulsivity, and inattention are all symptoms of ADHD, symptoms that can often be attributed to low levels of GABA in the brain. A 3-week double-blind, placebo-controlled pilot study was conducted to determine the efficacy of valerian tincture on ADHD. 30 children between the ages of 5 and 11 years, pre-diagnosed with ADHD, were recruited. A valerian tincture or placebo was given to the kids 3 times per day for 3 weeks. The study found a statistically significant improvement in the kids' behavior, with particular reference to sustained attention, anxiety, and impulsivity and/or hyperactivity. 31 outpatients who were diagnosed with obsessive-compulsive disorder were recruited to participate in a double-blind randomized trial. The patients were randomly assigned a capsule of valerian extract once per day or placebo for 2 months. The study showed a significant difference between the valerian and the placebo group by the end of the treatment. The researchers concluded that valerian extract has anti-obsessive and compulsive effects in patients with OCD. During World War I, valerian was used to prevent and to treat shell shock in frontline troops, and it was used during World War II to help to calm the residents of London during air bombing raids. More recently, a double-blind, placebo-controlled trial with 24 healthy volunteers received 3 separate doses of a standardized product containing lemon balm and valerian extract, plus a placebo on separate days, separated by a 7-day washout period. The results showed the 600 mg dose of this mix reduced anxiety, but the highest dose did not work as well as the lower dose. The research team concluded that the combination of lemon balm and valerian extract possessed anxiolytic properties. Recommended valerian doses for stress reduction is 200 to 600 mg of a valerian extract. Valerian tea, 1.5 to 3 grams of valerian root steeped in boiling water. For insomnia, 300 to 900 mg of valerian extract, 60 to 90 minutes before bed. For the mix, 120 mg of valerian extract and 80 mg of lemon balm extract taken 60 to 90 minutes before bed. Studies show it may take a week or 2 of continuous use before you experience the full effects of valerian. Valerian is well tolerated and safe in most people, but side effects can occur, and they include a headache, dry mouth, excitability, uneasiness, heart palpitations, stomach upset, and even insomnia in some people. Although it's rare, some report feelings of sluggishness the next morning. A few have reported vivid dreams when using valerian. If you're prone to nightmares, valerian may cause you to dream more and to have more nightmares. Valerian root smells particularly bad, and it's offensive to most people. If you can't stand the smell, make sure that you get the supplement in a capsule form. Valerian can interact with and should not be used while on prescription antidepressants or benzodiazepines. Valerian is especially helpful for people who are suffering from anxiety, chronic stress, and insomnia. Valerian is reported to work well for those who are dealing with obsessive-compulsive disorder, taming racing thoughts, and being helpful in dealing with stressful situations. Valerian is also helpful for those who are suffering from the hyperactivity that's associated with ADHD. You can safely take up to 900 mg of valerian daily if needed. 1 dose first thing in the morning, 1 dose early in the afternoon, and the last dose in the evening. Valerian as a sleep aid seems to be particularly effective when it's taken with lemon balm. The two work in synergy to help to promote sleep, but when combined, use a lower dose of each.